Everyone, in this video we wanted to talk to you a little bit about appeal to authorities and kind of like the fine line between being an authority figure on certain topics and not being an authority figure but still being knowledgeable about them. And this is a topic that Briana and I often banter with each other about quite frequently because there's no kind of limit to the amount of people you'll encounter who present their credentials like,
badge of armor,
like as validation for what they're saying. As if, like, for example, when we were going through the whole cancer stuff in the beginning, we had this issue with oncologist doctors that would kind of talk down to us in the sense that they're the oncologist doctor and they would speak like, okay, well, because I'm the oncologist, that is enough to verify whatever I'm telling you. And we would like be sitting there being like, well, like, here's the actual research on melanoma.
And
like,
why don't you know it?
Why are you familiar with this? Like, your appeals to authority, the fact that you are an authority figure is meaningless to us. And it's a fallacy.
And it's always been that way for me. My grandma used to tell me that some people graduate at the top of the class and some at the bottom of the class, and you do not trust a label, like, at all.
Yeah.
Because they could be dumb as fuck.
But then they still graduate, right? And I mean, I'm sure many of you listening have encountered individuals that hold some credential, no matter what it is, that and the person still has no idea what they're talking about on the subject matter.
And you're like, how did you even get through school?
Yeah, and a lot of times it's because going through schools is just jumping through hoops. It doesn't actually challenge someone's ability to critically think on the topics, nor does it challenge people to be able to go out and seek information and analyze it. Instead, it gives them textbooks, especially academically, and it focuses more on just having them regurgitate the information that they're being fed. And so a great example of this is with myself. I got my master's in nutrition and was set up to go and become an RD. My master's degree is in nutrition and dietetics. It was one that had me take additional counseling courses, everything to set me up to go into a registered dietitian internship. And I applied twice, the year I graduated and then the year after that, and both times I was denied. And so the second time I applied.
This is while you're working in the nutrition field, which is what hardly anyone in school is doing.
I was working in the nutrition field throughout the master's program even. But I asked them why, like, I asked 3 of the internship directors why I wasn't accepted. And unanimously, they came back and said, well, it's because you don't have experience working in a hospital system. Well, what do you mean working in a hospital system? Like, how am I supposed to be in a hospital system if I don't have an RD credential? And they said, no, not like in that way. We mean like, just experience in it, like serving food to patients, And to me, it's like, wait, so the reason I wasn't accepted was because I didn't waste my time serving food to patients. Instead, I was literally at that time writing the continuing education materials for registered dietitians. And it's just like,
the system is broken.
And so I was like, okay, I don't even want to be an RD anymore. I'm just going to keep doing my thing. And so theoretically, I could sit there and go up and debate people with registered dietetic credentials. I don't have one. But does that mean that they know more than I do? No. Does that mean I know more than them? No, it doesn't. But I mean, the fact that they are an RD is basically meaningless to me. And I think that
goes with any profession too.
Yeah, it goes with any profession. Like, if you're a medical doctor, that's awesome, but it doesn't mean that you know what you're talking about.
Or that you can even think outside the box and make a difference in evolution. Like, maybe you're just regurgitating what flowcharts tell you to diagnose people with.
Yeah.
Which is what I came into contact with a lot.
Yeah, exactly. And so, and we aren't saying this applies to everyone.
No, we have some phenomenal friends that are RDs and doctors.
Exactly.
That can really use critical thought and have intellectual conversations, but that's more uncommon than common.
Yeah, all we're saying is that, in theory, somebody having a credential should suggest that they have a higher than baseline level of knowledge on a topic.
And that isn't true.
And that just doesn't seem to be the case. So, and the fact that people don't have credentials doesn't mean that they don't know what they're talking about. So
I used to get "you're just a hairstylist" all the time when I was establishing myself in a different career, not realizing that, I did go to college before I was a hairstylist too, doing pre-med. It's just ridiculous that people make those assumptions off of a fucking degree or what you label. What you see in my Facebook profile, like, I'll never post all my education. Like, that's ego satisfaction and has nothing to do with what I know. Nothing.
Yeah. So, this was more of a kind of ranty video, but I think it serves a good purpose, and that purpose is simply to don't get caught up in credentials.
It's a good baseline. If you're looking, as far as cancer, I probably wouldn't have went and seen anyone that wasn't an oncologist.
Yeah, exactly.
But that doesn't mean anything. That doesn't automatically earn my respect and my trust just because you have that.
Well, we ended up finding a new oncologist because the previous one was dumb as shit. He couldn't even hold a conversation with us on.
He didn't know any of the new research,
on melanoma immunotherapy.
We brought it into him, and he's still like, "Oh, this is awesome! I haven't seen any of this yet." And I'm like, "It's been out for a few years, and this is your job."
So it's, maybe an outlier example. I don't know. The only point we want to get across is to come on. Nope. Okay. Sorry, guys sitting down there begging because she wants us to hold her. The point we're trying to get across is don't, credentials do mean something, but they aren't, the end of the story. Don't just focus on them.
Exactly.
So if you like this video, then great. That's what we're trying to do. And if you know someone who you think this information would help, then please send this video to them. Thanks.